Happy Monday, everybody. We'll wait for this waiting room to clear out. The moment it clears out, somebody else joins. Well, welcome to tonight's panel. This is technically part 5 of 4. Don't even try to do the math on that. In a series that we're doing called Working with Senior Singers. Tonight is wicked exciting because it's a panel of 4 incredibly knowledgeable, fantastic, wonderful experts in the field. And could not be more excited. As always, we want questions. So please put your questions in the chat. I'll message in the chat here in about 2 seconds. If you would rather only I see the question rather than the whole group, you're welcome to click on my name and send it to me individually. That's totally cool. So yeah, I'm gonna get out of the way. Without further ado, Jeanie LoVetri.
Thank you, Marty. I want to acknowledge Marty has been our wonderful host over the last 5 Mondays. Yes. He does a terrific job in making sure I'm staying on a straight line and that you are all getting the information you need. As it turns out, this topic was red hot, and who knew? I mean, certainly I didn't know that there was so much interest in senior singers. And really, if you look for research or information on seniors, there's almost none. I mean, we do have medical information about aging, and Dr. Wu will help us out with that. But insofar as pedagogy, like how do you work with an older voice, anybody's guess. Some people don't because they think it's not possible. You know, it's all of the map. I just worked with 12 singers from the age of 58 to 83. And we got some really remarkable results in a half an hour with quite a number of them, like maybe half of them. And so unless you want to attribute it to magic in me, it's really possible to get results in people who are not, quote, young anymore. And to help them sing, if not perfectly, at least in a functional manner. And that's information that everybody needs. The previous 4 webinars were on different topics about older singers. And I think we're going to do another one of these in the spring. I'm also going to do one on posture and breathing, and I may bring in some other experts. Of course, we have quite a few people who are expert. And I am not announcing the dates yet for anything because the whole Baldwin Wallace changing things around has shuffled our plans. But if you keep your eyes on my new website, which is www.jeanielovetri.com, the dates for upcoming webinars and or trainings will be there. And when things are more settled, we maybe have a more formal announcement. So I am now going to introduce our amazing panel. I'm so excited about this. You can't possibly know what's holding me on the ground as I'm like floating like helium here. I am going to start with Dr. Wu. Dr. Peek Wu is an internationally recognized laryngologist and clinical research scientist and author of the book Stroboscopy. He is a renowned laryngological surgeon and is a member of a number of medical associations and has people coming, observing him with patients from all over the world. He has designed specific surgeries for professional voice users. And he is a professor of laryngology at the Icahn Medical School at Mount Sinai Medical Center and is active in training residents and laryngological fellows. That's a lot to say. And his research interests are investigative high-speed video laryngoscopy in diagnosis of complex voice disorders and minimally invasive office space laser treatments for patients with focal fold lesions and scar. His private practice is located on the Upper West Side of Manhattan, and he has published 149 medical and clinical articles. I consider myself very lucky to have him close by so I can yell, "Peek, help!" And he usually answers that. And then our next expert is Dr. Joan Melton, who I have had the privilege of knowing now for quite some number of years. She is a Renaissance woman for sure. In 2025, she was the recipient of the American Academy of Teachers of Singing Award for cross-disciplinary research. And she's a pioneer in the integration of singing and voice movement training for actors and singers. She has 3 groundbreaking textbooks, One Voice, written with Kenneth Tom, in its 3rd edition, Dancing with Voice, and Singing in Musical Theater. And she has taught at major centers of drama and music in the United States, the UK, Norway, Sweden, Ireland, Australia, and New Zealand. But she's also an incredible pianist, a composer, a voice coach, and a singer, and has done lots of different work in multimedia. She's no slouch, you know what I mean? And then I want to introduce my dear beloved friend and colleague, Dr. Anita Kozan, who is in Minneapolis. She is a speech language pathologist whose doctoral work focused on the care of the voice, including voice care for singers and actors. She has a private practice in the Kozan Clinic for Voice, Speech, and Spirit, and focuses on providing voice and speech services for people who have good voices and want to make them better, but also voices that need help. She is also a specialist in the development of the voice for persons who are transgendered, and works with both male to female and female to male transsexuals before, during, and after their transition. And she is brilliant at that work. She has lectured for local, state, national, international audiences, and has been president of the Minnesota Speech Language Hearing Association, where she has been honored by for her contributions. She also produced a video in which she had the vocal folds of internationally known ventriloquist James Wedgwood as he performs various character voices. In addition to her interest in voice, she also has an interest in the spirituality of voice as a personal tool of expression and growth. And then our last wonderful expert is Dr. Andrew White, and he is in Nebraska. He is at the University of Nebraska, Kearney, and he always teases that he's out there with the cows. So he's singing opera to the cows. He has a very impressive resume and has distinguished himself in recitals of French melody, German lieder, contemporary American art song, and has done many premier performances of present moment composers. He has participated in the Cleveland Art Song Festival 6 times and was first prize winner of the 1995 Richardson Awards in vocal competition. And then when he was a student, he studied on a full scholarship in Switzerland with the eminent Gerard Souzet and Dalton Baldwin. And he made a New York debut recital here at Wow Hall. And his reviews have said that he is a formidable interpreter, and every song composer should be so lucky to have a collaborator like him. He has published several articles and has written a chapter in a textbook, and his doctoral thesis work was in on Schumann's Opus 24 Liederkreis. So these are really incredible experts, and we all have a really interesting point of view. So I'm going to start with Dr. Wu. Then we're going to have each of our guests speak a bit, and then we will talk to each other. And finally, at the end, we will allow you to ask us questions. You may at any time write your questions in the chat so that Marty will see them. And we do that so that in case any of you write similar questions, we will only condense it down to one to save time. All right. So Dr. Wu, let's go.
Well, thanks, Jeanie. I feel like you're just down the street from us, from us, which you are. You know, I think you're about 3 blocks away. I'm on 91st and the Central Park West, and you're on 93rd and West End Avenue. But it's great to be with you all, and thank you, Jeanie, for asking me to give a little chat with you all. Being a otolaryngologist and a doctor, I feel a little lost if I didn't have slides. So, but I don't have to. I did email my slides to Marty Laitman, and he's welcome to share. But when Jeanie asked me to talk about the aging voice, I thought, well, gee, this it's such a big topic because it's not it does not a day goes by that I don't see some sort of age-related issues in my practice. And we're all uh, we're all becoming more aware of it. And in fact, um, the understanding probably the biggest growth medical specialty in our field it's no longer pediatric, it's going to be geriatrics, because we've gained since Medicare came in 1964. You may or may not know this, but the average life expectancy in 1964, when Medicare came in and you could get your Medicare with around 62 or 63, was like 3 years. So the average life expectancy back then was 65, 66. And now today's terms, the women can be expected to have a few more advantages than men, but they're in the 80s. So now we've gained I want to say 2.5 decades of life. And that time is not just static. That time should be lived well. And the quality of that time should be used to be understood both by our specialty, and that's why now there's an NIH Aging Institute and so on and so forth. So with the time that I have, as I think about the aging performer or the aging singer, it's not an accident that, at least in my building, we see a lot of aging rock and rollers come by. Deep Purple. Who knew? I was so excited when I saw the lead singer from Deep Purple come by and say, hey, I used to know. Anyway, but they want to keep going, and they get paid, and so, but there are certain components of it that are medical that comes up again and again. I thought I'd just take the next 10-15 minutes, if that's all right with you, Jeanie,
Absolutely.
to talk about it.
By all means.
So the title is called The Aging Performer and Singer, and really what to consider. All right. So if you could go ahead, advance the slide. So really, and just keep clicking. Yeah, I thought I'd go ahead and have a conversation regarding some of the anatomical and physiologic changes to the vocal system that clearly will affect as our system as we get older, and to know the common medical issues that I see that often affect performance, such as mucosal hygiene. It may impact on singing effort, and then endurance. And then, well, I'm sure we'll have a lively question after that. Advance the next slide, please. So we can start by just briefly presenting this case to sort of anchor your thoughts. Here's a gentleman who's now 83. He's pretty good. He comes in on his own. He's had heart disease, kidney failure. He's known to have aortic aneurysm. He's been admitted for heart failure, and his voice is poor. He does enjoy singing in synagogues and leading prayers. He wants to be active in his culture, and he has a mild tremor. He has hearing loss, and he has arthritis. So this sounds like a lot, right? But he's active. He doesn't want to just fade into the sunset. And he's already on drugs like Lasix, spironolactone, and he's also, wouldn't you know it, he's also a transplant patient, and he's on CellCept. So go ahead, advance next. And here is his vocal fold. And I don't know if there's a good sound, but it doesn't matter. But what you can see clearly is that he's trying awfully hard, if you click it again, but he's not able to get good closure, right? And the other thing that you see here is a lot of thick mucus, right? You see a lot of goopy, sticky mucus, and he can't get good closure. So these are two of the very common things that we see. So if you'd advance it next, that we run into. So, you know, the issues related to the aging voice sometimes can be considered anatomical. So we know that once you pass age 60, each year you'll lose 1% of your muscle mass. So it's not, so in 20 years, you just don't lose 20% of muscle mass. So if you hit 80, right, you don't lose 20, it's 1% each year. And so it's actually probably like 25%. So I didn't do the math, but you can just imagine if you lose that much muscle mass, it's not just muscle mass in your quadriceps or your biceps, it's your respiratory muscle mass, it's your diaphragm mass, it's your vocal fold mass, right? Because vocal folds are skeletal muscle, a lot of it. All right, so you lose breath support, you lose ability to expand and to expire, you know, breathe out. So your strength on positive pressure generation reduces. So that's a classic example of sarcopenia. And from the aging literature, we know that sarcopenia can be reversed, but it takes a heck of a lot of effort, okay? You can't just, say, I'm gonna just continue to do what I'm doing to reverse sarcopenia. So, you know, what you thought you walking 10,000 steps when you're age 50, it doesn't do it when you get to, you know, age 80. You have to do positive strength training. So along with that are a whole host of other anatomical changes. So for example, we know that the vocal fold ligament and the layered structure changes as you get older. And that's and probably the area that is most obvious when we look at the vocal folds is the extracellular matrix, the lamina propria. That lamina propria is really the jelly that sits in, you know, between the vocal ligament and the surface. And that jelly has to be fairly robust. Otherwise, you'll have a sort of a breathy voice quality. And so you may try using more effort, but if you don't have good lamina propria, then that will then result in something called vocal atrophy, beyond what is seen when you have muscle atrophy, which is the sarcopenia. We also know that in the larynx, the range of motion reduces, right? Because so that if you were to feel your own larynx and squeeze it together in a young person, in a teenager, and the larynx is actually elastic cartilage, very, very pliable. And if you did a CAT scan of their larynx when they do a falsetto or a pitch glide, you'll see the thyroid cartilage change in configuration. Isn't that amazing? It does. And in that range, you start to have ossification centers in the laryngeal cartilage when you get into late puberty. So throughout your lifespan, you've turned cartilage into bone. And when you turn cartilage into bone, that bone is much less pliable in terms of its a configuration change. Not only that, but you also have a loss of joint motion. So the cricothyroid joint, the thyrohyoid joint, they also become less pliable. Lastly, and probably most people don't know this, as you get older, your larynx descends. You start out your larynx when you're a youngster with your larynx up in the back of the nose. Do you all know that? So that's why the babies cry and you can hear them in the back of the plane because they have tiny little larynges and it's like a little tiny bell, you know, it's like ring a bell. But nobody can ever hear the basketball player talking in the back of the plane because they're tall and their larynx have dropped into the chest. It's like, but as you get older, one of the main hallmarks is that the vocal tract, the larynx descends. Well, you would think it would be great because classical singers want the larynx way down there, but in point of fact, that often results in a somewhat darkening of the voice quality. Okay. So those are all things that will not change. Those are anatomical changes, laryngeal descent, calcification, so forth. And then there are physiologic changes that occur. And we know that as you get older, the mucus viscosity changes. I mean, probably one of the biggest problems that I see daily from older patients is, why do I have mucus, right? Why do I have thick, sticky mucus? And that's because the ratio of mucus glands of serous versus mucus glands changes and becomes more sticky, more proteinaceous. And depending on the how much, like there are many medications that interfere with mucus production, and there are even medical conditions that interfere with mucus production. Next slide. Can you advance the slide? Yeah. Yeah. So in the realm of medical conditions that we see as you get older, for sure, we know that your lower esophageal sphincter, once you hit past 35, unbelievable, 35, that valve starts to give. And if you're a singer and you're leaning on that valve all day long with your diaphragm, it's probably kaput by the time. So one of the questions I had for Jeff Laitman, who's a famous anatomist at Icahn School of Medicine, I said, how come God only made the lower esophageal sphincter last for 35 years, right? But now we're living to 85. He says, well, just think back when man was running from the dinosaurs, they only lived until about 20. So 35 was plenty. All right. So we have outlived our evolutionary cycle. All right. So for sure, all of you, once you hit 60, your lower esophageal sphincter is just not good. And then you put that with modern lifestyle changes, right? I mean, how many of you eat dinner when it's still light out? None of you probably do. I'll be eating dinner like right before I go to bed tonight, right? So that's modern lifestyle, okay? And many of us are on drugs, okay? Not illicit drugs, but our society is often highly values a drug, a quick answer. And if you looked at all the different antidepressants that my singers are on, if you look at all the diuretics, if you look at GLP inhibitors, right? That's a common one these days for weight loss, as well as they have side effects. All the antidepressants, almost all of them, cause a dryness of the mouth, and then that interferes with the ability to sing. So all these things contribute. And then if you add other things such as COPD, sleep apnea, diabetes, bronchitis, all these things are important in our consideration. All right. So so it's not a single entity, and very often what we have to do is sort this out. So from that point of view, we can go to the next and my last slide. So, what can we advise you all to do? First of all, staying young with your voice is an active measure. It doesn't, just because you've been singing well for a decade, it's not going to stay with you if you stay static. That's for sure. People talk about how your voice changes every decade. That's true. It's true. I've noticed my voice changing in, and I've been doing my own laryngeal examination for 40 years now when I first got the stroboscope. And I can see that, I'm in my 7th decade, and it's I can hear myself being a little bit more vocal fry, right? I don't have that light tenor voice that some people said I used to have when I was younger. I now have a little bit of that thing. So what do you have to do? It's one of the most important things that is try to actively seek out uh, positive reinforcement for your vocal system. One of the things that I like, and I don't have any, is um, active inspiratory and expiratory respiratory training. Okay, so this is something called the breather, and I tell my not so much my older singers, but my older patients that have voice difficulties, they should consider getting it. It's $45, and it comes with different, little things here. So for both positive inspiratory training and negative for positive expiratory training, and these are helpful to help keep the respiratory muscles engaged. All right. So that's an example. The use of SOVT exercises. It's here. Somebody said, what is the breather here? It's called the breather. So if you go to Google and just go the breather, it's about $60. Okay, I have no, no interest in financial interest in it. All right, but it's very simple. It's a simple device. Okay, there may be other ways that you can do it too, but including balls and so on. But you have to sort of plan on doing that. The vocal range exercises are great. SOVT exercises. I'm sure somebody will talk about SOVT exercises, a warm up, cool down exercises. Okay, you should take an active role in what's called mucosal hygiene. You have to understand just like you have to understand a song. How do you keep your throat well lubricated? A well lubricated vocal fold will stand up to singing much, much more than a dry throat. And whether that dryness is from too much coffee, it's from too much alcohol, whether it's that dryness from too much acid reflux, or whether it's from medication side effects. By you taking active role in improving the mucosal hygiene, you can get a vocal fold to do a lot more and stay healthy. We know that the phonatory pressure threshold, that is the minimum number of centimeters of water necessary to get the vocal folds going, is much lower, which is what you want, if you have a wet vocal fold than if you have a dry vocal fold. That's it. Okay. So when a singer comes in, like, seeing some bunch of singers these days from Masquerade, because they have a lot of dryness and performance smoke, if we spray their throat with a little lubricant, a little anti viscosity agent, reducing agent, they can sing better. So you have to pay attention to mucosal hygiene when you get older. You have to understand your environment. Okay, so don't try to decide all of a sudden you're going to take on Santa Fe opera when you've been singing at sea level. Okay, you should have in your back pocket a trusted singing and speech therapist. And I always say they are your friend, and they should continue to help you. And finally, any system that it's there, it's meant you have to either use it or you lose it. And I encourage all of you, just click one more time to what we say, enroll yourself in wellness programs, especially for people who tend to lead very sedentary lives. So my last slide, go ahead. So we try to individualize therapy because it is a whole big conglomerate of things, and beware of psychology, function, and use both medical and therapy techniques to improve all these factors. And don't always think that a brief intervention is the solution. Look for the long-term goals. All right, thank you.
That's absolutely wonderful, Dr. Wu. Thank you. That sets us up really well for Dr. Kozan, because she also is in the medical clinical world. And so, Anita, take it over.
Thank you. I was expecting Joan was going to go next, so I'm just kind
I
of
know, but
sitting back. But
it's
you're
my
right,
prerogative as the host to change my mind.
and we know you, Jeanie.
Yeah.
You are in the moment. Thank you. Thanks so much, Dr. Piku. Oh my gosh, it's just so great to hear you. Review and tell me a bunch of new things, new ways of looking at things. I appreciate you very much. The world, my world is about voice and speech and spirit. I put that pointedly on my name of my little solo practice because it is mind, body, and spirit that affects our voices. I've been doing this work since I was in a all original band, late 70s, early 80s, and I realized I was performing and rehearsing without injuring my voice. I was also working as a speech and language pathologist. And that was what made me decide, okay, I talked to the otolaryngologists in St. Paul where I was working and said, please don't do surgery on your patients who are having vocal problems. Please send them to me first. And they did. And that was the beginning. So went on to open the first voice laboratory using video stroboscopy in Minnesota, thanks to the recommendations of the otolaryngologists and the hospital where I was working, and continued on learning so much from video stroboscopy, and then decided to work on my PhD at the same time, and studied warming up the voice for singing, which had never been documented in terms of the positive effects, which were proven with 40 singers and 20 experienced teachers of singing as the judges, who could pick out the warmed up voice. And they didn't know what the study was about. They wanted to know, was it about the effects of milk? They were guessing, but in 39 of the 40 singer subjects, the judges could pick out the warmed up voice. And that 40th singer, who was a woman in her 20s, classically trained, but she told me it took her 45 minutes to warm up. And I knew that that was not a healthy necessity for her voice. So I've seen many patients with injured voices, speaking voices, injured singing voices, and learned some things that early on were very important to me. The concept of cool down was first presented at the Voice Symposium in New York in 1984 by Dr. Alfred Lavorato, a speech and language pathologist and professional singer, who took the time to talk with me after the conference was over and really explain how warming up and cooling down can help literally decrease the amount of swelling of the vocal folds. And his singers were rock and roller screamer types who had no voice the morning after a gig. And Dr. Lavorato had them first warm up, but that didn't make a difference. Being quiet after a gig, that didn't make a difference. Cooling down made enough difference that he said they had voice the next day. It wasn't great voice, but it was the first time that they were able to speak, which means that the swelling of their vocal folds went down enough that the vocal folds could vibrate and the singers were able to sing. Well, that for me was a manna from heaven. And I just started using it with people who came to me with injured singing voices. Then I carried it over to injured speaking voices, using it with then people who are transgender and gender non-binary, along with the other principle that I think has guided my work intimately since I became aware of it in 1994, which was the idea of interval training of of those of us who have healthy voices. Yes, we are conditioning them, and I think somatic voice work is the most phenomenal technique for doing that, totally compatible with the best principles of voice function for speech and language pathologists. And I have lectured internationally about somatic voice work being an excellent way an excellent system to use with teaching singing to transgender and gender non-binary people. But the idea of interval training with an injured voice, I mean, the research which was done in the 90s, early 90s, in Minneapolis at the Sister Kenny Institute, looked at more of literally using your muscles. This was with physical therapy. Use your muscles, then rest. Use your muscles, then rest. And then the other group used their muscles, and these were all people with post-polio syndrome who had had polio as teenagers or young adults. And what they found out was that for those people who were doing the exercising nonstop, their muscles were weaker at the end of the exercise period than they were on the tests prior to exercising. The group that worked in an interval training model exercised for a few minutes, rested, exercised a few more minutes, rested, and that carried on, and their muscles were stronger at the end of their exercise period compared to how strong they were before they started. Well, that was the other thing that just lit such a light for me of importance, that it's one of the principles that I use even with healthy voices, and because people get so excited, sometimes they really want to overdo it. So I feel like there are probably 5 other things I want to tell you, but I am singing myself. I'm going to my first lesson on learning to play electric bass is tomorrow morning. And all right, Marty says, and
Yeah.
it's like, I'm 78. I figure I got another 20 good years in me if I don't get in an accident. And as a singer, songwriter, play alto sax, keyboards, I want to keep on going. So
Thank you,
that's me.
dear, wonderful Anita, for being on this planet. She comes across as this very quiet Midwestern expert, and she's really a wild woman. We've been friends for 40 some years, but I never know what she's going to do. It's so great, which is a perfect introduction to Dr. Joan Milton, who is also an amazing and unbelievable person who does lots of different stuff. So, Joan, talk to us for a few minutes about your work.
All right. Can you hear me?
Yes, we can.
I got unmuted. All right. Well, Jeanie has already given a lot about the background. Mostly I work with actors, professional actors, and I'm a voice movement specialist. But I started life as a pianist and a musician. And recently, this is the part that really goes along with this program. Recently, I have had an interesting opportunity to work with retirees in a church. I am in a church sanctuary at the moment because I'm between places to live, and the church was kind enough to let me meet here. I have been working with a group of people who love to sing but don't read music, haven't sung in parts before, and this is totally new because I'm used to working with pros, but I have learned a lot. They have taught me a lot. And I regularly teach actors individually or in shows and so forth, and I specialize not in singing or speaking that uses microphones, but for example, in outdoor theater. I coach for New York Classical, outdoor theater, parks in New York, no microphones. They're not shouting at you. They're not hurting themselves. In other words, they are learning, and it's all connected with movement as well. I'm in a sanctuary, and some people are moving upstairs, so that's kind of unexpected, so working against that. Anyway, I work with movement, with the older singers, older people as well, and it works. It's been really a joy. And I wasn't sure, but it worked very well. And before every rehearsal, every week rehearsal at 2 in the afternoon, or actually we start the rehearsal right here, and they're sitting in chairs, but then they get up and they have learned to play. And we start every session with, yeah, we're here. And it's wonderful. At first, people thought we were crazy. I thought I was crazy. But they like it, and then they do some legato. Then they do what they love is the staccato arpeggios. I've done a lot of research with physiotherapists. There was, the start of this was in 2007 in London, and then we went to Brisbane, the University of Queensland, and that was 2010, then to Tasmanian College of the Arts in 2013. And in all of those studies, we were using ultrasound imaging to observe lateral abdominal muscles, especially transversus, and to see what they did in all kinds of voice making with movement. Actors have to be able to use voice in any position, moving or still. It doesn't matter. We've got to use voice, and we got to use it safely. And learning what is going on in the abs made so much difference. It freed us up, and I pass along. I can't tell you a lot, but we work even if they're doing staccatos. Very often they're in this kind of position because gravity helps them to let go of the belly because they only do one staccato per breath, ha, 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 or whatever it is. And with the whole group, I regularly start on G below middle C and go up to a high B flat. So the men have learned to use their falsetto again, and the women have learned that they have low notes and they have high notes. And that is very important. It is super important in a speech class to have singing, singing exercises. It will make all the difference in the world in what that speaker has available. Anyway, we did that. We also explored the movable parts of the vocal tract and different, excuse me, I'm needing a bit of water here, the different sounds that they can get. Many of the people I've worked with didn't even know they could sing, and now they're singing. Nearly everyone in the group has sung solos. So they explored different kinds of sounds, and they are learning to communicate with the people in the audience, not just to say, I've got a beautiful voice. Not that, but to really use the language to communicate what they need, what they want to say to the audience, and it's different depending on the style of the music we're doing, that kind of thing. Then I want to tell you two other things. This area where I am is it's the altar area, and they don't stand in one little clump the way they did at the beginning, and they don't stand in lines. They stand in what one of the engineers in the group called stereo. They stand, you know, here, 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 and they use this whole space. And it has made a tremendous difference in the way they sound to, of course, the congregation loved them. The other thing is that I don't get up and direct them. I'm over at the grand piano, and they are learning to listen and work. I call them an ensemble rather than a choir. And as they learn the piece and know what they're doing, who's doing a solo where and all of that, then I back off with the piano. They lead. And their confidence has grown as individuals and as a group. And so it has been fun for me to work with people very different from any that I've known before. They're all wonderful human beings. And each one is unique and special. And I've worked with them individually before and after rehearsals, as well as in the group. So it has been a joy, and I appreciate this new learning that I didn't know I was going to get. So that's it.
That's great, Joan. Thank you. That's such I would say that I know all of you well enough to know that you are always learning.
Yeah.
As much as we all know, and we do know a lot, we're always learning new things. We're always studying and talking to people and sharing information. So now our last panelist is Dr. Andrew White, and he's in Nebraska. He's a classical baritone. So Andy, talk to us. Tell us about you.
Well, of course, most of the students that I teach, I'm a university professor. Most of the students that I teach are college age, but I also, have been a private voice teacher and I've been at it since the mid 1980s. So I've taught all ages of student and through all ages of myself. So having the perspective of being a young voice teacher needing to teach somebody who's dealing with end of life or later in life singing, and also being, now I'm 64 years old and dealing with all ages still as well, and then of course seeing what has happened with my own voice as I age, and some things have happened as I got into my 60s. I had to sort of retrain and had to go through some experiences. And I would just say that I see it as there being sort of three categories of issues that arise. The first category being basic aging, such as what Peak has been talking about, such as what women experience around menopause, for instance. So there's this incredible loss of estrogen that throws off the balance between estrogen and testosterone in the body, and all of a sudden elicits almost, I mean, you might even call it a mini male puberty that they have to deal with. It can be very, very troublesome for some women, and some women don't experience any problem with it at all. It's very different depending on the person, but that's something. And then men also experience changes, such as what Dr. Wu was talking about with there's like a thinning of the tissues that happens that causes the male voice, particularly in the 80s, but it can happen younger, to get actually elevated pitch slightly in the modal speaking pitch, and to have, as we saw in his slides, greater difficulty achieving complete glottal closure. And so there's a breathiness, inability to sustain pitch. Some older men will actually gain a couple of notes in their range on top. um,
Mhm.
because of there's this thinning of the tissues that allows the vocal folds to be pulled to a tighter pitch. But the lack of core to the tone and these sorts of things, this can be very troublesome. But this is my first category, just sort of aging changes, things that happen to everybody. But then there's a second category where singers, people who have been using their voice at a very high level for many, many years, have parts wear out, and they develop a paresis or some type of dysphonia. These are, medical issues that arise. If you've got an old car that has a part that wears out, you can replace the part, but you can't do that if it's your voice. And there are some things that just plain, over the years, there was a good example, a great example is George London, who one vocal fold just became paralyzed. And he managed to compensate with the other vocal fold and continued singing for several years at a very high level after that happened. But, ultimately he had to cease his career as one of the most extraordinary. I mean, you can't say there was anything wrong with his technique. He was an extraordinary, one of the greatest singers of the 20th century. But sometimes parts just plain wear out, and then you have to figure out what you're going to do about that. And then there's the third category, and this is the category about which, I'm probably the most qualified to address. Other people on this panel are better qualified to address the first two categories that I mentioned, and that is this hardening of the technique that can come when you get older. And there's a very frustrating situation. Suppose you've had some particular approach to your vocal technique that you learned back in college, approach to your breathing and approach to your resonance or whatever. That's always been your sort of go-to, and you can always do these things, and it helps you to sing well. And then all of a sudden you find that those things aren't serving you. And in fact, it seems like the more you work those things, the worse your singing gets. And this is a very sort of disturbing thing, because your set of tools is suddenly not working for you. And so anyhow, there are these sort of three, and they can come in combination. You can be having a little muscle tension dysphonia and also have your vocal technique hardened. You could be dealing with some sort of health issues such as acid reflux or whatever, and then also be dealing with the hardening of technique. But basically, with the hardening of technique, what's usually happening is that the certain something that you've always done, that's always worked in the past, becomes hypertonic, and you've gotten locked into what you always have done. And once you're locked, you need to develop the pliability, and you may find that you need to have an approach to technique that's exactly the opposite of what you have always done. You may have to find yourself doing something that you used to think was wrong, in order to get yourself back on track again. But the need to establish a balance, and here's something else, just a basic idea. You can't live on dessert. You cannot survive on dessert. The one thing that your voice has always done well, and that you always enjoy doing, and that there's the one thing that you always do with your voice, if you do nothing but that, even that will go bad. You need to do everything with your voice in order for it to maintain pliability. You need to use your entire range. You need to sing both loud and soft. You need to do both legato and staccato. You need to different vowels. You need to You know, it can involve doing different things, stylistic, different kinds of styles of music. You can there needs to be enough pliability in what you are doing that that you're not getting locked into a way of doing things.
All right, Andy, thank you so much. Well, as you can hear from everyone, they are each very unique in their expertise, bringing a wealth of life experience. I specifically asked them because they have been doing what they do for quite some time, and there's something to be said for that. And so I would like to ask Dr. Wu, you know, we're very lucky here in New York to have some of the most recognized laryngologists in the country and therefore in the world. There are still not that many laryngologists in otorhinolaryngology, and not all of them have the high-speed camera. And so I have worked with quite a few older singers who have been to see qualified laryngologists who look at them with a strobe and say, well, your vocal folds are great, you're fine. But the person singing has enough life experience to go, I can't do what I used to do. And so they are unfortunately misdiagnosed, and it makes the person who's singing feel like they're crazy. And Dr. Wu has access to high-speed video strobography. Jesus, I can't talk anymore. And I think that's a really incredible tool that he and others in the medical profession have for us as voice trainers and voice users. So my question, Peak, is, and maybe you can't even answer this, but is it possible that more laryngologists will be able to access high-speed camera diagnosis? Because I think that would be helpful.
Thank you for that question. You know, I like to not have the group think that having an instrument will help solve a problem, because I really don't think it's that's the solution or the answer. You know, we used to say, oh, you have the laser, so now you can do laser surgery. You know, it's just a tool. Oh, you have stroboscopy. Now you can identify vibratory abnormalities. It's just a tool. And you know, unfortunately, the world of singers' complaints sometimes doesn't fit a standard model of what we think of in terms of organicity. Organicity meaning, okay, you have a medical issue, you know, it's due to a single organic cause. Very often, singers have feelings, you know, that things aren't right, but they might, because it goes through, you know, goes through the emotional side of the brain or whatever, it doesn't come out as a single if so facto solution. So a clinician, you know, often, let's be honest, a clinician is a busy guy. You know, they're inundated. I know that in some parts of the country, that average time to see a laryngologist is 3 months. So if you have a real problem, waiting 3 months may not be the solution. So unfortunately, that is the reality of the situation. There's a large chasm between, and so I always say, we may not know what's going on, but we'll help you to keep looking. We can try this or that. And, you know, unfortunately, a lot of medical intervention is empirical. It's not based on, oh, we can do a biopsy of your mucosa and tell you have reflux. Oh, it's because you have gluten allergy that you're having so much mucus, etc. Okay. So I appreciate that you gave my high-speed video a plug just because, you know, I was able to see some things in your case that we probably couldn't see before. But in general, I would say that that's not the answer. Technology is not the answer. It's the willingness of the clinician to help you explore. That's the answer, in my opinion.
Okay, I think that that's important. I heard your lecture that you did for the group that used to be spasmodic dysphonia. I don't remember what they call themselves now, but
Mhm.
you talked about that paresis is tricky. You know, it's a tricky thing. And I have worked with enough older singers who have been told there was nothing wrong, only to have them go to you. You say, well, you know, there's this. And I want to ask you the same thing. As a clinician, when you're working with older voices, do you find that you hear, let's say, questionable responses from the mechanism in older patients? Does that come up more often than it used to?
So when you say questionable responses, you're just talking about a difference to my ear, a difference in tone, or is that what
Well,
you mean?
something that falls outside what we would consider normal vocal response in a person who kind of has always had normal vocal response, but
Mhm.
who isn't necessarily diagnosed as having a pathology. Oh, you have a nodule, you have a polyp, you have a, I don't know, Reich's edema. You just, the voice is not behaving the way it used to. In understanding all of what Dr. Wu
Yeah.
explained to us, um, do you interface with that more often or in a different way?
I feel like just in my life, going about, being uh, at meetings of people whom I don't know and listening to voices, that I hear changes in the voice, and I'm making guesstimates about the person's age, but I feel like I do hear that in the people who have come to me as clients, um, both in medical settings in decades past and now in private practice. They know that something is changed, and usually, I mean, the thing that I've been dealing with most recently is an incredible singer who's sung all her life, taken good care of her voice, and has a tremor, and it's strong enough to literally interrupt the tone. And so we are working on trying to determine ways that we can have her be exercising her voice. And of course, she and I and many others in our age range, unless you've got a regular gig, you often don't practice very, as much as we should. And so that always, for everybody is
Mhm.
one of the first things of, are you exercising your voice? And then of course, using somatic voice functional techniques of the chest register and head register and working on the mix. But um, I feel like I have to refrain sometimes because it comes from that place of wanting to help, but it's like that woman or that man did not ask you, Anita, about this is just in society, in life, they didn't ask me for help about their voice, and I think, oh, I can hear something in their voice. I think I could do something about it, but that's not my right. I don't
Mhm.
feel, to say something unless I hear something that I'm so worried about that I might say, have you thought about seeing a laryngologist, a specialist to look at your throat? So, I, if that's the answer that you're looking for, if there's more, Jeannie,
Well,
that
it's like Pete said, it's not that there's an answer. I'm interested in um how we manage. I don't have equipment here. I can't see somebody's larynx. I can't see their vocal folds. If they're lucky, they've been to a laryngologist or somebody like you. And I've been told, oh, they have XYZ something. But if it's just that they're older and they want to keep singing, um, in somatic voice work, we go all over the map. We don't try to sing in a certain kind of resonance and a certain kind of placement. I mean, everyone who works with me does every kind of sound. That's what Andy was talking about. So I guess I'm looking for your approach in terms of strategies, which you explained. I would say, Joan, you could kind of fold in somewhat from what you just talked about in your ensemble that you're
Yes,
working with.
yes.
I know that you've worked with older actors, you've worked with actors who maybe aren't able to do what they used to do. Do you do anything different because somebody's older, or do you approach it the same way for anybody? Does it change or no?
That's such a great question. Just today, I've realized I have worked with older actors, but no matter if the person is 25 or 85, it's unique. And I look at their background and I try to help them get to where they can do whatever it is they need to do safely and work it their way. So I didn't even think about their being old. And it really, the first time I even thought about I'm working with people who are older singing is when I am working with these people, their professions are not professional. They're not professional performers, but they want to sing, and they are older. But it's just fascinating to me as they find their voice, as they realize it's not just in the throat, but the whole body and the spirit are involved. I think we don't have to think about them necessarily as older. Of course, if I were a laryngologist or, someone who is a medical person, you'll look at things differently. But I'm just trying to help them do safely whatever it is they need to do. And when I have a problem, I call Kenneth Tom because he is a speech therapist, he is a singer, he is a movement specialist, and I will sit in with them and he will help in that way. So I think it's great when we can work together. I'm good at something, but I'm not trained as a laryngologist or a speech pathologist, but I learn and they learn from us as well.
Okay, yeah, that's good. What about you, Andy? I know you've been continuing to sing and concertize as a classical baritone. Do you change? Have you changed your approach to your voice? I mean, you alluded to that when you were speaking.
Yes.
What sort of adjustments have you made on yourself?
Well, I had to. I started to experience muscle tension dysphonia, which I had to go and seek a diagnosis, and through that process, I worked with a voice therapist, speech voice therapist. But she was also a singer and understood the singing voice as well. And so through that process, I was exposed to some therapeutic approaches to the voice. And I have been exposed to some therapeutic approaches to the voice as well, past students that I've had who've had some trouble. Well, actually, one elderly student that I had who had all kinds of he was diagnosed with an arthritis of the vocal fold cartilages, which is something like what Dr. Wu, I think, was talking about, that the cartilages themselves can not only ossify, but also the joints between them can become, arthritic, or you're just plain not moving as well. Um, and I was able to go to his therapy sessions and sit in on his therapy sessions. And I would just say that a knowledge of therapy from either having gone through it yourself or having, if you can get in and see what people do as a voice teacher, that is so valuable. Because I tell you what, we here in the United States, healthcare, unfortunately, is a privilege and not a right. And so there are a lot of people who cannot access uh, and get a diagnosis, cannot access a doctor, cannot access, if they can access a doctor, can't access a therapist. And it may just fall to a voice teacher to have to find some way to help this person,
Yes.
you know. And so being aware of therapeutic approaches is important. But I had to uh, well, there's the Stemple exercises, of course, or anything where you're dealing with sustaining, just plain holding notes for very long periods of time, which is a way of getting better glottal closure. By the way, uh, I noticed Dr. Bozeman was writing uh, in the chat and came up with a very important question, and I hope Dr. Wu will answer him. And it has to do with whether or not once through exercises and through therapy, is it possible to rebulk the vocal folds? He's been told by Dr. Tizzi that it isn't possible once the bulking has been lost, that's the horse is out of the barn, it's over. But maybe it's possible through therapeutic work to regain some bulk. I just don't know. And he was asking that question. But you were asking about things that I have had to do. One thing that has been very important for me personally is to maintain uh, a healthy low voice. The connection between the low voice and the rest of the instrument has been a lifesaver for me. Um, One of the things the first thing that goes in my voice when my voice is not working well is the bottom of it. And I know that if I've lost my bottom, the rest of the voice is shot. So that's been a very important, and I think often overlooked. Especially I think tenors and sopranos and people who sing high, they want to just sing high all the time. And you need the bottom of your voice for the top of your voice to work well. And if you're a belter, well, you need to keep your head voice in place. And if you're a head voice singer, well, you'd better be working your chest because you need the whole voice to work in order for the thing that you do to work. I already talked about that before. But one thing that happened with me was I always had the ability to do what I called feathered dynamics or feathered registration. If I could take a note in falsetto, and crescendo or decrescendo by adding the chest voice element and removing the chest voice element, and all the little areas of gray in between. That was sort of my calling card as a younger singer, and that fried out. It got to the point. I mean, just in that little demonstration I just gave you, you could tell that wasn't entirely smooth. When I was a younger man, if I demonstrated that, it would have been just as smooth as silk every single time. But those things that you do well, that's the thing that fries out. But in fact, through a concentrated effort, particularly in my case on vibration, sensations of vibration, experiencing sensations of vibration. And this is sort of going off of the Kitty Vertoloni resonant hums ideas, that you're experiencing this sensations of vibration that fosters development of the release of hyaluronic acid, which is restoring to the voice. Her research on that, sort of taking that idea and thinking about experiencing sensations of vibration in the instrument. In the low voice, I feel the sensations of vibrations in my chest. High voice, as I move up, I feel it, hitting the chakras all the way up. And doing this sort of work for me is what really has brought my voice to the point where I could use it again. I really was afraid at one point that it was over, that I was going to have to retire from performing and concentrate on other things. But I have found through the therapies that I have tried, I have gotten myself to the point where in some ways I'm singing better than ever.
That's good.
So that there is and there has been hope for me, and I am sure that there is hope for all. If you're struggling, if there's a problem, there are things that you can do. You might not be able to get back exactly what you had before, but you might get something that is in some ways even better,
Mhm.
or at least better than what you had.
Well, I think something that I try to emphasize in all of the somatic voice work is the interdependence that is so vital to those of us who work with voice training, to rely upon our speech pathology colleagues and our medical colleagues, especially our laryngologists, so that we can stay informed about correct understanding of the biological goings on in the profession. I know we're very lucky here. We have this extra laryngeal rounds every other month where the doctors and the fellows and the residents, they are showing their latest information, and the senior doctors like Dr. Wu and Dr. Pittman and Dr. Salika share information. And I sit there and like a kid in the candy shop, like soaking it all in. I'm never going to work with those people. This is a medical conference, but just seeing what they're talking about and understanding better the kinds of things that they confront when they're working with the vocal folds and the conditions that affect people's ability to use their voices. Some of the stuff that I've seen at these meetings has blown my mind. And I come away very humbled because I feel like the doctors are keeping people alive. I don't have to contend with that. And I think that these sessions that I'm drawing, I hope we're drawing, other singing teachers and other speech pathologists and voice trainers like Joan and like Andy, to appreciate all of the tools that are available to us from the other disciplines, the cross-pollination. Also to recognize that I have a lot of jazz vocalists in somatic voice work who teach and perform, and they're not making the kind of sound that somebody like Andy makes. There is no bone vibration. It just doesn't happen. So as wonderful as resonant voices are, if you're singing like this, you don't vibrate anything. You can't feel the thing when you sing this way. And we can't say those people aren't good singers or they don't have good technique. It's just that they don't make that kind of sound.
Yep.
And the more the classical world understands that, and that some of the tools that classical singers use just don't work in those other styles. They don't apply because these singers are amplified, and the ear is external, not your own ears. It's what you hear by the machinery. It matters in how the person singing sings. And so, the idea that, oh, you can always sing on vibration and memory. No, you can't. That's not true. But it's very difficult to convince people who are in a certain mindset about it that there's another kind of way to think of it. So that's why I really love this discussion. Now, I want to know if, well, first of all, Pete, can you answer the question about, is it possible to bulk up the vocal fold first? Can you answer that?
Yeah, so there's two anecdotal evidence that's quite helpful. So one example is like if you went into the hospital and you had major open heart surgery and you lost 25 pounds and you became very deconditioned. It's a very real term. And then now you can't swallow, you're choking on water, and your voice sounds like you've aged 20 years. You lost 25 pounds, and now we're getting consulted because they're getting ready to put a tube in your stomach because you can't swallow and this and that.
Wow.
And we look at all the data and we says, look, your vocal cords are not paralyzed. You're very, very deconditioned. So deconditioning is real. I mean, you whether it's due to malnutrition, whether it's due to lack of activities of daily living, and so on. You were hospitalized for a month. Okay, so what's the rehab plan for that person? You go to rehab. Most of those patients do go to rehab because they go to an interim facility, and if you go to a good rehab place, they'll kick you out of bed 4 times a day, and they'll do, and all of a sudden when you see them a month later, and there's a rationale for that, by the way. There's a voice training technique called LSVT therapy, right? Lee Silverman voice training technique.
Right.
Takes a Parkinson patient 4 times a week for 4 weeks. That's a huge commitment on a Parkinson patient. But why the 4 weeks? Why is it that that when we see those patients, they go to rehab, we say come back in 6 weeks? Why is that? Well, how long is boot camp? Marine boot camp is 4 to 6 weeks. We know that that's how long it takes for you to train new muscle to sarcomeres to take over, for the fiber grouping to occur, right? The nerve goes in, and instead of only 6 different fibers, now the fibers are thicker. It's true that if you are in your 90s, there's a lot more fibrosis between those fibers. But you've seen octogenarians that are buffed in muscle, right? So for sure, it's possible to train them. So there's 3 levels of evidence. So one evidence is the patient that are deconditioned and come back and they're a different person. A second level of evidence is the presbyphonic patients, the patients in their 70s and 80s. They says, doc, just give me an implant or give me an injection to make me better. And we send them, say, no, because you have to learn how to walk before you can run. We send them for therapy, and about 40% of them don't need anything more. So what happened? You can say, oh, their vocal cords didn't get bigger, but maybe it's their breath. But who cares? If 40% of them don't need anything more, then what's the problem? And then the last level of evidence is what I've told you about LSVT therapy. The LSVT therapy has been shown to be very helpful for aging voices too, both for swallow and for voice. Isn't that interesting?
Well, when I first was at Mount Sinai observing you, I had never been exposed to the Lee Silverman techniques. And I heard the speech pathologist working with the Parkinson's patients, and I'm thinking, holy moly, what are they doing? Because it sounded like a lot of yelling. And
That's
then,
right. And in a way, that's what, Joan, you're talking about. You want them overextend beyond
Yes.
than what is the norm. Am I right?
Yes. Yes.
You want them they're used to stopping at 85 decibels. You want them to 95 decibels.
Yeah.
It's okay. It's okay to scare yourself.
but that's what when I heard
Right.
them and you explained to me what that was in the beginning, when I had the paresis, which you diagnosed in when I was 63 and now I'm 76, I went home and tried what I heard on me, and it worked. And I feel like that would helped, was one of the things that helped me. I didn't get all the way back, but get much better over time. Probably was at least 9 months of regular work before I could sing, really sing.
Yeah, so there's a lot that we don't understand from
Right.
exercise physiology, right?
Yep.
So as a laryngologist, I'm not an expert on that, but I think it's been shown in sports medicine and other specialties that, but it takes it's hard work. It's grit work. It's not easy. I'm sure, Joan, when you see your older patients, the last thing they want to do is to put in that 20 minutes of extensive
Pete,
time.
that's exactly what they have discovered. That in order to get what they want, it takes a certain discipline. That's what we learn as performers. It's daily. It's not just occasional. No. Not a day goes by that I don't do an enormous, a routine of exercises in the morning and in the evening and so forth. And that's why I'm 87. And, that's why I can do what I do. If I stopped doing the stuff, if I didn't do exercises, vocal, physical, and all that, and that's what people have to learn. And the people in the ensemble, I can't say they do it every day, but they have learned to do more than they ever did before.
Yeah, and Joan, you're a living example of someone who is maybe the number of age that you have after in your birth certificate, but you are the youngest 87-year-old I've ever known. and that's because of all the stuff you do and you continually do. And Anita, you're right up there too. And Andy's talk about how he has, in spite of his extensive expertise and experience, that he was willing to work on himself and pull himself back and do. So I want those people who are watching to understand that here we are, we're saying, no, we can recover, but we have to work. And Dr. Wu is emphasizing this as well, so that we are, I hope, teaching the singing teachers to understand this in a little broader way, to see this in more depth. And I know sometimes when I'm working with singers who don't sing very loudly, the kind of light, gentle singers, they really resist making a lot of sound. And it's like, no, I don't care if you don't sing this way, but you have to exercise this way, because this is what's going to get you to be okay in your quiet little singing and not have everything collapse. Do any of you want to ask questions of each other panel? And then I'm going to open it up in a bit for the questions from the audience. But do you have questions for each other or comments on anything that you have said as panelists?
I did want to mention, so just going off of what Joan was just saying. I think singers in their 30s and 40s kind of get used to being able to get away with stuff.
Yeah.
Showing up to rehearsal cold, and you'll be fine. You can get away with things when you're younger. The older you get, the less you can get away with.
That's right. They're right.
And that daily regimen ends up being, increasingly important.
Yeah.
I think it helps for me. It helps, and I try to bring this idea to my students. The word daily regimen. It just sounds so, like something you have to tolerate. But for me, the daily regimen is, it's like meditating, or it's self-care, because and I noticed that somebody was asking me to talk about the release of hyaluronic acid that comes from the experience of vibration. That's coming from this, and it's the way I interpreted what she said. So read Kitty Vertoloni's articles, and you decide for yourself as if this is what she said. But what I glean from it is that vibration is itself healing, and produces and causes the voice to release hyaluronic acid, which is healing. So sensations of vibration are important for me, and as I experience that, uh, I can, as I go through this process, it's healing. So the sensations of vibration are pleasurable. Okay. I mean, people use vibrators for pleasure, right?
Okay. We have
But
an X-rated panel here. Um,
I
and,
didn't say that
Andy,
kind of okay.
Andy, I
But
want to just make sure I want to catch this. I didn't before, and I want to say it. It's Vertellini, not Vertelloni.
oh
Yes,
yeah, I'm
Bertolini.
mispronouncing it. Sorry.
That's okay.
Sorry,
That's
I'm
all right. That's all right.
mispronouncing.
Yeah, Dr. Vertellini's approach has wide acceptance because it's really useful.
So
And so the vibratory, Anita, this is your
Mhm.
work with the spiritual side of this work.
Yes.
And those of us that are in the arts, we understand a lot of stuff can't be nailed down in an empirical heart no, what am I going to say? An imperial manner that's rational and measurable.
Yeah.
Yet it's very valid, and we experience it as being real, but
Yeah.
we can't explain it in a rational way. And so when you're talking about helping people find their sound, you're finding their inner sound that comes through. That's all one thing, yeah?
Yes. And I think that, sometimes I will ask people, depending, people who are transgender, can they hear a voice in their head that they think is their voice, or the kind of voice that they want? And it ends up being an exploratory conversation across sessions where they realize, no, they really don't want that sounding voice. They're in a position of authority in their job or something, but it's the whole thing of how we talk to ourselves, what we say to ourselves can play such a huge role in interfering with or helping us. And I practice myself this way in terms of thinking about my voice, but in helping people find their voice, find the sound that they want. I mean, I think about the music bypasses the cortex, the thinking part of our brain, goes directly to the limbic system where we feel things. It may connect to, memories, but that whole piece of thinking about just the vibrations of singing and the release of endorphins, of just feeling so good when we sing. It's exercise. I mean, our voice is the instrument that can't be put in the case. I mean, it's there all the time. And so to be working with it, and I think Jeannie, you were talking about this in one of the lectures of this past session, and it really hit me in terms of my work with a current client who has changed her posture. She is working on her breath support. And when she walked in to my house for a follow-up session, I was like, she looked like a different person because her posture was so erect and her head, in line with her body. And the whole thing of how we talk to ourselves. I mean, if I'm giving myself grief and that's going on and on, that's not creating anything healing or anything helpful in my body. So it's a very Buddhist principle, but it makes sense to me for all of us that if we are kind to ourselves, if we're seeing as we're practicing what is good about what we are doing, what do we like, and then if there's something that we want to change, that we talk to ourselves in terms of starting from that recognition of success, and then, okay, so I want to try to do this, or I'm going to do that, and not like, oh, for Pete's sake, Anita, what's wrong with you that you didn't you know?
Right. Well,
How-
you've seen me talk in the sessions, the past 4 sessions, particularly, we find what works first.
Yeah.
We find what is functioning at a good level first before we fix what's wrong.
Yeah.
We build on what's right.
Yes.
Sometimes if you build enough on what's right, what's wrong goes away without you having to deal with it. And that mindset that you're talking about, if a person is open-minded enough to say, well, I always used to sing this way and I would still prefer to sing this way, but I could still sing this way, and that would be acceptable. And that's what's so wonderful about the stylistic changes. Andy mentioned that maybe you were a classical singer and you can't do that to the level it needs to be done at, but you could sing jazz and be okay. And that doesn't mean that jazz is lesser, it's just different.
Different.
And it has a different criteria. I know someone who was having trouble singing because of a very severe injury and subsequent surgery on her cervical spine, and her voice was very messed up. But boy, was she disciplined about what you said, Joan, about practice.
Yes.
This woman practiced, and she got a lot better. And she's not also a young person; she's an older person.
Yeah.
And I wouldn't say that when you listen to her, you would think it was flawless, but it was musically accurate, it was expressive, and it was her determination to just work. It happened to be with my stuff, but it could have been with Dr. Stempel's stuff or somebody else's stuff, or anybody that has a conscious awareness of function.
Yeah.
It was really more the mindset if she was going to work at it.
Yeah.
She was going to do it. Okay. Any other questions amongst you as panelists?
Well,
Uh,
there are a couple other things I wanted to add about this
Yeah.
idea of self-care. So, like Joan was talking about staccato exercises, and the fact that the staccato, especially abdominal pulsation, it duplicates laughter.
Yes.
And
Yes.
releases endorphins, yeah, which is a very, positive, kind of positive psychologically and physically thing to do for yourself. And then then also just practicing we breathe abdominally, we practice abdominal breathing that triggers the parasympathetic nervous system, the rest and digest as opposed to fight or flight. So there are a variety of things that, as we're doing these various exercises that are I encourage people to see it as self-care, experience it as self-care, and I think you find that instead of it being a chore or drudge that you have to do, that it's actually you look forward to it
Yeah.
when you do it.
I agree, Andy, that we're reaching in looking at it as something that we get to do to help ourselves. That can be part of it. I also sometimes I will ask clients about their spiritual beliefs. Do they have a sense of a higher power, or is there something else that is uplifting to them so that they do not feel so alone in working on whatever, very demanding goals that they're working on? And I mean, it can be nature, it can be a person, it can be a higher power, but it makes a difference in how people feel about doing demanding work. Thanks, Andy.
Anybody else? Peek, do you have any questions for us? I mean, we learned so much from you, and you were so generous to share that information with us that we all need to know. But, now's your chance to get at us, ask us questions. You got any for us?
Well, I think, I mentioned a little bit about this more than 30 years ago when I first met with you. When I came to New York, I said, we in medicine, we don't like just things that work for one clinician.
Mhm.
Mm.
So unfortunately, even now when I have Parkinson patients, and they have specialists that can do this or that, and unfortunately, vocal techniques can be like that. Like I had a well-known classical singer that went down to have his sinus stretched, and and I went with him, and this was not a medical practitioner. It was they put in little balloons in the nose, and they blew it up, but it was just balloons. But this person must have enough followers so that there was quite a few people waiting outside his hotel room, waiting for it to be done. So, and unfortunately, especially in the world of where there's so much mind body interaction and so on, where there's belief systems,
Yes.
it's up to, I think, your group to help us sort it out and help. We don't have any issues saying, yes, we think you should have therapy, but then what happens when that person comes back and it says, oh, this therapy doesn't work, and I hear that all the time. And is it because of the person, or is, who's that, who is there? I'm not trying to say there's a fault, but I'm saying that we need more systematized study in this regard.
Yeah.
Movement, it sounds great, but what kind of movement?
That's it. You've got to find the right kind. Yep.
Yeah. So all that needs to be explored, and unfortunately, we may not have. Maybe AI will someday be able to say, "Oh, I've looked through the world's literature, and this works, and that doesn't work." Who knows? But that's a point that, as as somebody who is dealing with that interface, it's a daily struggle for me. Somebody says, well, maybe I should have had Alexander. Well, maybe in Feldenkrais, maybe Rolfing would have done it, or maybe I should send him to osteopath. Maybe I should have chiropractic work. You understand where I'm coming from?
Yeah. My understanding, as a person who is both very interested in science and medicine, but also very holistic and very spiritually oriented, and having tried in my own way to put these together, is that anything that is about making you more aware of your own experience being in a body, in a way that is loving and kind and accepting, is valuable.
Yeah.
And the measurement of that is what Anita said, what Andy said. Does it make you feel better? Does it give you more sense of empowerment?
Yeah.
Do you feel that this particular approach gave you something that you can use?
Yes.
If it makes no sense, or if you just do one thing with one person and then you jump to another thing with another person, and that's already not going to help anybody at all. And a lot of the people, one of the reasons that the various experts that have been kind enough to lecture for somatic voice work, including both Joan and Anita, are holistic in the sense that they greatly respect science and research. They have done research, as I have also, but that the linear thinking of a codified, you have to prove it to me, it will never apply to holistic stuff.
Right.
That doesn't mean it's not valid. And the only way you can, I think I said this to you years ago, if this is experiential work.
Yeah.
And singing is, you can only teach yourself to sing. No matter who the teacher is, I can't teach you to sing or speak. I can only teach you to teach yourself by increasing your proprioceptive awareness of what you feel and what you hear. And then the label to describe that is whatever it is. So in my having the great, tremendous opportunity to observe you and the other doctors, and also to ask Anita questions years ago, Anita, what is this? I don't know what this is. And she would explain it to me. The concrete information should not, no, the holistic information should never violate the concrete information. So in other words, if my holistic thing is in violation of what medical science has established, then that's a dichotomy that needs to be looked at. We can embrace all of what you do, even if you can't embrace all of what we do. And I think that's the measurement. I don't know, John, what would you say?
I like all the things you're saying. My thought has to do with what Anita was saying about the spiritual aspect, and music. Music is wonderful that way. I will just say I'm taking something from you, Jeanie. You talked about, we sat in a diner and talked for 2 hours the last time we were together. But we were talking about our mid voice being rocky and, okay up high and okay down low, but this middle voice is a mess. And you were talking about if you do it fairly softly, and every day of my life, when I am showering in the morning, when I did my master's recital in 1962, I sang all of the Barbara Hermit songs and a lot of other things. I like very far out stuff and have written that kind of thing. Anyway, I sing 7 of the Barbara Hermit songs because they're in the middle range, and I'm not singing real loud because I'm in an apartment, and there's great joy, and it's a spiritual thing, and I come out of the shower feeling wonderful. And I think we've got to find for ourselves what works, and we learn from our medical friends, our voice teachers, but we've got to find what works for us and be grateful for it, and be grateful for everybody who influenced us to come to that. So,
yeah. All right, now I want to ask the participants, if you have not yet written your question in the chat, now's your chance. These are remarkable experts with, our combined expertise is probably a couple hundred years worth of voice related life. Now's your chance to ask. I do not want you to ask Dr. Wu any specific medical questions about yourself. He's not going to diagnose you in a panel, but you can ask general questions about a medical or a clinical situation, because Dr. Kozan is not going to diagnose you either. And then Joan and Andy and I can talk about the applied work we do to help voices in all kinds of different applications. So go ahead, and Marty, if you have questions, you can start by asking them.
Yeah. We've got 2 here. One of them is a little specific, but I feel like it's perfectly appropriate. As a menopausal woman, 60 years of age, I have run into issues in my mid voice, F to B. And as a soprano, she can still sing high Ds and now has a low G since her mid to late 50s. The scope shows healthy vocal cords and a mechanism. What are some proper exercises to help strengthen the mid voice? Aren't we all asking about the mid voice?
yeah.
Well, Joan, what would you recommend?
I'd say go to Jeanie LoVetri. She's great with it.
Right. As a disclaimer, I didn't tell her to say that. Andy, how about you? What would you say to work on the middle voice?
Well, you've got to work the overlap, and
Yeah.
and that means carrying the head voice down, and practicing singing low in the head voice, which is not going to be very loud, and that's all right, be patient with that and spend some time singing low in the head voice. And yes, carry up the chest voice.
Right.
And find that, and then practice. Once you've done, a good enough, done that enough that there's a greater sense of balance going on, then you can practice singing softly in that tessitura, and will begin to find the mix.
Yeah.
And this is what, and now Jeannie will show you slides that are very useful in that. You can use second and third slides, and the vowel a is a helpful vowel for that. But the most important thing is when you're developing a hole in the voice like that, which is what sounds like what's happening with you. It's you've got to strengthen the overlap before the mix is going to really start to happen. But what you're after is the mix, and and you can get there through SOVTEs. Those can also be very helpful. So a lot of people like to use straws and water and that kind of thing. Personally, I find hums and lip trills to be just as good.
Me too.
So
I like
that
it.
there's my answer. I'm sure Jeannie will have a better one.
Well, I mean, my experience when I was diagnosed when I was 63 by Dr. Wu was that I was asked to sing, and I was trying to do some classical operetta pieces, which should have been really easy for me. And I got up to sing, and hardly anything came out, and I was completely flipped out. I was singing like this, and I couldn't understand what the heck had happened. But I actually felt that my left vocal fold had stopped functioning. And I know you're not supposed to be able to feel that, I know. But when I went to see Dr. Wu, I said, there's something wrong with my left vocal fold. He looked at it, he said the high-speed camera, and then I could see it myself that it was vibration. And then when I got to around F above middle C, the left vocal fold went like this. And then it came back again around C5. So what I've done is what Andy just said. Taking head down. Just head, and then just chest, and loud, really loud, and then the SOVT E, the and when I first had that problem, I couldn't do 2 octaves. So the pull, the elasticity came back. And then I know that I can sing in the middle, but I can't get loud. It won't let me get loud. So I just sing quietly, and then I can control the pitch, and I can control pretty much everything else, but I might be a little breathy. But it took a while for me to figure that out. So a lot of it is trial and error, but you have to, I think it's hard to do it for yourself if you really don't have a clear idea about vocal function, or like say musical vocal function. Anita, would you agree with that?
Yes, I would. The one thing that I would add, I agree with all the techniques that have been described. And the thing, even with somebody who does, I mean, I've worked with injured voices for decades, but now with mainly healthy voices, but still people who are learning a new way of approaching best vocal function, to do things at a moderate or softer volume to make sure that I'm not having the person overdrive their voice. And I will use interval training of that the person sings, and it might only be 15, 30 seconds, a minute, and then rest for a minute or two. and usually I'm talking during that minute, but then go back to the vocalizing. And so, and also I check in with the person, okay, how is this feeling? Do you still feel okay? Is there any discomfort or fatigue or tightness, soreness? And so I use that as a guide for we might need to do if we were focusing kind of in one area of the voice, especially if we're in the mix. Okay, let's just do a little vocalizing in the chest. Let's do a little in the head. Let's do a great big long slide across the ranges just to give the vocal folds a break
Right.
from our work to try to condition them in an area that, in a way that they're not used to working.
Okay, that's great. Marty, we have other questions?
We do. Dr. White was saying something earlier about the idea of vibrating the vocal folds, enabling the release of hyaluronic acid, which helps the voice. Did we get that right? Did we understand that correctly? Beautiful.
Yeah, he says yes.
Awesome.
Okay, and what else? What other
What-
questions?
I'm trying to think. There are two other ones. What are some books or techniques that you feel we should be aware of that would continue our education on the topics that have been shared tonight?
Well, Joan's 3 books are phenomenal because they're very you can apply what she's talking about in her books. So
Mhm.
I recommend those very much.
Thank you.
And I don't have a book yet. Sorry, I know I should have one, but I don't have one. But it depends on what you're looking
Yeah.
for. There are literally hundreds of voice books in classical vocal pedagogy, which is aimed at singing classical literature. I personally do not believe that alone will teach you to sing anything else.
Mhm.
I think it's great if you're going to sing classical rep,
Mhm.
but not necessarily like if you want to be in Rent.
Mm.
It doesn't fly.
Sure.
There are no really obvious books about that yet.
Yeah.
There are some books that I think are acceptable and good, and Ann Peckham's is one. She teaches at Berkeley. And there may be others that I'm not aware of. But that the books that are aimed at not classical music, some of them that are available are cuckoo, and so you don't want those. It's like somebody made up something,
Yeah.
and then they decided it was real because they made it up, and then they made a method. And everything about my work is based on traditional pedagogy, voice science, voice medicine, and I didn't make up anything. I just put it together, but I didn't make anything up. And a lot of these people have, I don't know, they take a bath and get an idea and then they sell it to the world.
Sounds fun.
What else, Marty?
There is one quick question.
Yeah.
Wondering about hearing and voice relationship as we age. Are there any studies on this that you know of? And the answer is we are working on one, sort of. Do you have any cool down regimens for yourself and or your students, clients? And if so, do they vary much between singers working in different vocal styles?
Anita, that's for you.
If the person, depending upon the person's level of ability, they might be doing more advanced warm-ups. But usually what I say is to cool down, it can even be in speech. If I'm using a very legato line and I'm, oh my, moving my pitch up and down. I mean, I had the experience once of, for 3 minutes, I came home from a party, a lot of background noise, and couldn't even come in normally as high as I was used to. For 3 minutes, I just did slides and then just talked, and even some of the same sentences being said over and over again. Oh my goodness sakes, and what do you think about that? And oh my, within 3 minutes, the swelling of my vocal folds had gone down enough that there was no more fatigue or discomfort, and my range was back. Now that was a very healthy voice to begin with, but I do have people use the things that they're most comfortable with. I'm not looking for your highest notes. I'm not looking for your lowest notes. I'm not looking for anything loud. I want it soft, preferably soft. Sliding down is easier for most people, sliding up,
Yeah.
but it can be easy vocalises. But it's simply to, as Ingo Tizzi says, you're releasing the heat from the vocal folds and you are flushing the toxins from the muscles. And that's why our voice feels good, normal the next day if we do cool downs. And that's why.
Anita, I wanted to
Oh,
say,
sorry.
I don't, you can, both you and Joan, Andy too, really, but would you be willing to do some private sessions on Zoom with people who would like to get more specifics from you?
Absolutely.
Definitely. And you were just talking, Anita, about speaking. What I use all the time is Shakespeare. Of course, I work in that area, but it can be wonderful, speak the speech. Speak the speech, I pray, as I pronounced it to you, tripping in the tongue. And it's lovely, and it's getting you, as you say, it's not extreme, but it is playful, and it seems to be good for the voice.
Yeah, classical sopranos and mezzos who are taught to stay in head as a dominant sound have a lot of trouble coming out of head when they come low into the pitch range. And they can't go, they don't have that capacity. It gets programmed out. So in those people, having to teach people to make that deliberate change, or with the male voice to not just bellow and push chest straight up, is the whole point of taking training. Because if that was easy, singing teachers wouldn't exist. That's supposed to be what we address. And resonance is a nice device, but it's not always about resonance. So anyway, I want to do two things before we come to an end. We have been, the LoVetri Institute for Somatic Voice Work has been housed in Baldwin Wallace University Community Arts School since 2017. Due to some whatevers at Baldwin Wallace that has nothing to do with us, we are no longer supported by the college. So I am actively seeking another home in a university, conservatory, any place where we would fit to move. And so if you are a person who is in a university who wants a program that is extremely successful, makes money, and has contributed a great deal to teaching singing in all kinds of ways, please send me an email, Jeanie@LoVetri.com, and JeanieLovetri, looks like LoveTri, but it's LoVetri.com. That would be very helpful to me. Then I will let you know if there's going to be more activities, but there will definitely be webinars in 2026. And so to come to the end of this session, I feel very, very grateful for the tremendous expertise that these four generous people shared with us tonight. It's not the kind of information you get just anywhere. And it's not the kind of experts that you find in the phone book. These are very special people who have made a significant contribution to their own professions, to what they have contributed in their own work, and who are warm-heartedly sharing what they know with all of us who were able to watch this, and which I hope I will be able to put on YouTube. I'm still learning how that works. And of course, we thank all of you, because without an audience, we could just talk to ourselves and have fun, but it's more meaningful if we have helped you understand a little bit more about each of these aspects of voice use. And so I want to thank Dr. Wu, Dr. Kozan, Dr. White, and Dr. Melton, and Marty Lemaine, without whom I couldn't do this. And I hope that you'll have a wonderful Thanksgiving coming up soon. in the United States. Those of you that are in other countries, that you have a wonderful holiday season and a great 2026. And hopefully I will see you then. Thank you all so much.
Thank you.
Goodbye.
Bye-bye.
Bye bye.